Good evening, friends. I'm Dr. Anurag Mishra, and we are back with another clinically relevant case. Rather, today we are going to discuss one of the most important topic, which is the breast lump. And now, breast lump, an approach to a patient with breast lump is again very important clinically. We see a lot of patients these days with carcinoma breast or at least breast lumps. Various factors for that. We'll talk about it. So this is and also it is asked a lot in examinations, both in theory as well as in practicals. I think no student can skip this topic from the examination. So this is an important one. This is a slightly longer topic because everybody expected to know all the intricacies and details of carcinoma breast and the breast lump. So what we will do is we have broken down this topic into 3 parts, and then in subsequent sessions we will cover these 3 sessions. So today we are going to talk about general history mainly. We'll restrict to various factors in history and how we should approach. Then in the next talk we'll cover the examination in detail, how to examine, what are the things which we would expect a surgeon to examine in a breast lump patient. And then we'll go into investigation and management of a breast lump, where we'll be talking about what investigations are ordered, when, and how they are interpreted, and then how to manage a case of breast lump. So let's start with that. So when we see breast diseases, there are various symptoms by which patient can present, and there's a list of what all can the patient present with. So it can be pain. It can be pain in breast, in a localized part of the breast, or both breast, or the whole of the breast. It can be a lump. It can be a nipple discharge. It can be change in size or shape of nipple and areola complex. It can be change in the overall breast size and shape, or it can be some sinus, some wound, something over the breast tissue. These are the various possibilities by which the patient can present to you. Now, if we talk about, let's talk about the symptoms one by one. So pain is a common feature. If you take the whole symptomatology, pain in breast is a very common presentation, especially in young girls. So now pain can be cyclic or non-cyclic. When we say cyclic, that means it happens in patterns, typically in a cycle of 30 days. Patient will be able to tell you that it has some relation with the menstrual cycle. So mostly people will say that just before the menses are supposed to start, there is a congestion and there is a pain in the breast. So that is because of the influence of the hormones on the growth. So that is cyclic mastalgia. Or sometimes it can be not be very directly associated with the cycles. So then it's called non-cyclic mastalgia. In terms of causality, both cyclic as well as non-cyclic mastalgias have a hormonal background, and these are mostly physiological pain because of the changes in breast tissue which happens because of the surges and changes in hormone level in body. So now pain, the management of pain has various things, which is a separate lecture altogether. So then we say about if there's a lump, but that is without pain. Okay, so painless lump. Now it can be, a painless lump can be because of carcinoma, cyst, or fibroadenoma. Or a painful lump can be something like an inflammatory mass mostly. So whenever somebody comes with a lump which is painful, I would think more of benign causes, which are inflammatory causes, rather than malignancies. A painless lump, then I will be more suspicious about malignancies. So it can be carcinomas, fibroadenomas, or cysts. So lump, solid lump typically is a malignancy. Now, one factor I want you to emphasize, and the whole why a good examination and good clinical history and examination is important is the fact that you must understand that when a mitotic cell or a cancer cell in breast, it divides 30 times, okay, then it forms a mass which is like 1 gram in weight. So you can imagine like it will be just a maybe 0.25 into 0.25 centimeter. Barely you may not be able to palpate it ever. So that's a size of after 30 cycles of mitosis, to create this. Now, 30 cycles means 10 raised to the power 9 cells, which is roughly about 1 gram of clinical tissue. Now, after that, 10 more divisions, like means for 40 cycles, it will have 10 raised to power 12 cells, and this will weigh around 1 kg in mass. So you can imagine that 1 gram to 1 kg, it takes just 10 more cycles. And 10 cycles for a CA breast is typically, so one cycle in a typical average carcinoma breast would be around 80 to 100 days. So 10 more cycles means, let's say, 800 days. So like just 1 or 2 years. And so it rapidly increases. So from 1 gram, which is not palpable clinically, not detectable clinically, even with ultrasound, it may not be detectable, to becoming a 1 kg. And you can imagine 1 kg means it is beyond any cure. So from nothing to incurable, there's very little window in which we need to diagnose and treat this. So the whole art and skill of surgery is whether you are able to pick the cancer at a very early stage. Now, yes, you can say the screening methods can be used, but screening methods itself, one, they don't have very high yield, and then they're very costly. Like doing a mammogram or ultrasound in everybody may not be feasible in a country like India. So that's why one thing which we can learn well is how to palpate a breast properly. And also to detect the what are the features of a very early cancer breast, and which we'll be talking about in this lecture or in the subsequent lectures. So that is the kinet, and there's a lot of difference in kinetics and how cells divide in a malignant cell as well as benign cell. Obviously, we know that we have learned in oncology that in a malignant tissue, there are higher proportion of cell which are in dividing phase. Now there is a G0 phase where the cells are not dividing and they're resting cells. And then a proportion of these, let's say in typically 5 to 10% of these cells are in active dividing phase, and that keeps changing. Whereas in malignancy, what happens, there are around 60 to 70% of cells are in dividing phase. So that increases the energy requirements, that increases the growth. The lifespan of cell is higher in these malignant tissues, and there is a relatively prolonged or normal cell cycle time is also there in benign cells.